I want you all to know what are the myths that are surrounded around endometriosis. So let me tell you that 10% of women all in the world are suffering from endometriosis. But there are certain myths that you would have heard about. I would like to tell you the facts that are true to endometriosis. So the first myth that you all know, I will have a very painful cycle, I'll have lower abdominal pain, or my flow would be very heavy. It's a myth, it's not a fact. Why? Because it's only one spectrum of the disease. There are a lot of women who would come and tell the cycles are normal but still be suffering from endometriosis. Second would be pregnancy is the cure of endometriosis. Not really. Pregnancy in that period of time can help and relieve your pain, but it does not cure endometriosis. Endometriosis will always cause infertility. No, only 30% of women who come with endometriosis might have difficulty in conceiving. Then endometriosis cannot be cured. It can definitely be cured, but yes, there are chances of reoccurrences. But if you get or detected in early stages, the number of operations and medications can be decreased. Hysterectomy is the cure of endometriosis. No, it is not. What if you have endometriotic nodules or tissue which are beyond or which is not near the uterus, it is in the intestine or in other places, as you know, then if it is not removed, then you might not be relieved with the pain. Then endometriosis is solved if you have menopause. There are few cases in 2 to 5% of people, even post-menopausal endometriosis is seen. Now, endometriosis can cause cancer. This is the biggest thing that you would be hearing. But no, endometriosis does not cause cancer or does not lead to cancer. The pain is very severe, or it will always cause pain. Only 60% women would be coming with chronic pelvic pain. Then what are the other myths that you would be knowing about endometriosis? That it only occurs in women who are younger in age. No, or who are older in age. Not really. Women who are getting their periods very early are also more prone to endometriosis. Women with cycles that are irregular will have endometriosis, and though surprisingly, even lean girls or girls who have very low BMI are more prone to endometriosis. So these are some myths that are around endometriosis, and I wanted to break it. And one more thing that I've seen people thinking ultrasonography is clear and we don't have any findings saying that you have endometriosis does not make you or eliminate you from not having endometriosis, because endometriotic nodules, if it's not deep infiltrating, would not be captured or would not be diagnosed through ultrasonography. So we cannot be very sure that ultrasound is normal, so no endometriosis. No, we have to clinically relate to your findings and tell you about endometriosis.